Do you need me to ask you a question,
Heidi?
Yes,
I do need you to ask me questions.
Heidi, what did you do before you did BIM?
I was a medical publisher for Oxford University Press and Radcliffe Medical Press and Elsevier.
What's that? Not what are the publishers, but what does a medical publisher actually do?
So they publish books in print form, and I'd done that for about 10 years when I began to see that what was happening online, and looked at social media and realised that we could publish online and not just in print form, and that actually it's a way of disseminating information which is quick, is to specific audiences, and to me it changed my whole mindset of what we could do in science, in health and in communication. So I had a conversation with Lorimer about doing a blog and finding people who are good at communicating and disseminating, and we started 2 years ago just out of a conversation after lunch. Set up the blog, and we began by just doing abstracts of articles, and very quickly we moved to inviting collaborators to blog as well, because we didn't want it just to be a one-man show. We wanted it to be proper dissemination and proper conversations and debates about evidence we're finding in research. What is evidence? Is it reaching clinical practice? And the jury's still out actually as to whether what we're doing has an impact. I'm still trying to figure out how to measure that, where the conversations are going. Does it actually impact what people are doing in clinical practice? Is it going to change how we research? Is it going to change how our research is measured? Peer review? Is it going to change funding? I feel like we're on the beginning of a whole new way of communicating, and it's really exciting. I've come to Adelaide to see BIM here for the first time, and I see the BIM logo on doors of offices, and it's quite incredible for me to see this after 2 years of just starting out on this blog, and seeing some of the receptions and the comments we're getting on the blog and on Facebook and Twitter, and I'm really excited to see where it's going to go.
Are other people doing this, Heidi? And if so, who are they, and is it working for them?
That's a good question. We did a very
small
question. We did a very small study where I had a look at pain research journals to see if they were using social media, and they're not at all, and that really surprised me. This is a few months ago, in January 2011. But the big medical journals are. New England Journal of Medicine is doing a fantastic job. They have a blog, they're tweeting some of their papers, they're making some of their papers open access. Public Library of Science have an open access journal, and I think they are beginning to really change the way journals are interacting with their audience and also with their authors.
Are they measuring it? Are they measuring if they're having any effect?
I don't know how actually. They must be looking at the impact of, I guess there are citations online, but I don't know actually how they're measuring it as far as social media goes. It's a good question.
And you're not a physiotherapist, you're from a publishing background, you're not a psychologist or an OT or
a researcher.
All those other things. Oh, are you not a researcher? That's an interesting question. Why BIM? Why not British Tobacco?
I couldn't possibly run a blog using British Tobacco.
It was a leading question, wasn't it?
It was a leading question. I feel like we can actually impact, is that the right word? We can make a difference, hopefully, maybe, in pain, in people's pain research, and how people maybe are being treated, or some of the techniques that are being used. I'm not sure, but I feel like if I'm going to get involved in anything, this is really important. And if it changes how we research, and if it changes the outcome for patients and also clinicians, then I feel like it's a really good thing to do. Pain's huge. I know what that is. I don't like it.
Well done, Heidi.
Thanks.